I don't understand why they allow the toxic chemicals in the nail products that the workers use.
Advocates and researchers are calling for better working conditions for nail technicians as a University of Toronto study finds, quote, high levels of hazardous chemicals in nail salons.
Some of the levels were up to 100 times higher than what we found in homes. But they were also much higher, up to 30 times higher than what we found in an e-waste facility. The concern is not for the clients who come in and have brief exposures, but we're very concerned about the nail technicians.
The team of researchers, which also includes the Parkdale Queen West Community Health Centre, looked at 20 discount nail salons in downtown Toronto, finding high volumes of plasticizers and flame retardants, saying exposure is dangerous. Nail technicians have been worried about their health.
It's quite a wide range of concerns, skin disease, breathing problems, reproductive concerns that these workers have.
Jackie Liang, a nail technician for more than 10 years and advocate with the Nail Salon Worker Project, says the findings weren't surprising.
Most nail technicians have skin problems. My throat is itchy and I cough right away.
The researchers want the industry and government of all levels to put in more measures and protections for nail technicians, including using
the cosmetics hot list,
a list managed by Health Canada. They didn't comment on the study, but did tell City News all cosmetics sold here must meet regulations and not pose any health risks. Researchers say adding the hazardous chemicals could be a game changer.
It's a regulation, and that means that it is legally binding.
The Ontario government funded this study, with the Ministry of Labour saying it's currently reviewing the results, adding that it investigates all complaints received related to workplace health and safety, providing advice and enforcement, among other supports.
Chemicals are getting into these workplaces, and products that perhaps we didn't think would be used in workplaces are being used in workplaces, and we need to consider that in our regulatory approach to chemicals.
Jackie calls the study an opportunity for change, hoping not only for better regulations, but also for improved workplace ventilation to protect those who depend on these jobs.
At least have some people to pay attention to us.
Specifically, hazards to vulnerable populations just doesn't get enough play. We're not doing enough studies.
The researchers say this is a first step, and they hope to investigate more workplace hazards at nail salons. In Toronto, I'm Faiza Amin for City News.